and I'm excited to share with you some exposure exercises that can help with anxiety and panic disorders. So we know that fear of all those uncomfortable physical sensations can aid in continuing anxiety and panic attacks. So one of the best ways to lessen that fear and anxiety around those sensations is to face them directly. So I'm going to share with you a few exercises you can do with clients that will teach them that they're okay and that they're not going to die or have a heart attack when those physical sensations come up. Alright, so before you start any of the exercises, your client that may be coming in might already have heightened anxiety coming to see you, so you just want to set up a really safe space and make sure they know that if they have a panic attack in your office, it's fine. Judgment-free zone. If they need to leave the office, that's totally fine, and you're not offended or weirded out, but that it's a safe spot for them. Some of the goals of these exposure exercises are: 1, to gain more evidence that nothing bad is going to happen when these physical sensations start. 2, to gain more practice with coping skills, and this is a really important piece. So after each anxiety-producing exercise, you would want to tap into breathing, progressive muscle relaxation, guided imagery, whatever it is that they use to lessen their anxiety and get more to a baseline or below. And then the third goal is to gain more confidence in their ability to handle those physical sensations. Before you begin these exercises with your client, it's great to ensure that they have recently had a physical by a medical doctor, and that you've done a really thorough assessment of their physical sensations that cause them the most trouble. For example, let's say your client was feeling a really shortness of breath and a racing heart. You could do a couple different things depending on their fitness level. If someone was in really great shape, you could do jumping jacks for 1 minute. And maybe if someone was a little bit less in shape, you could have them walk up a flight of stairs or simply walk or run in place. So that's for 1 minute, and that will produce shortness of breath and a racing heart. And in case anyone watching doesn't know what a jumping jack is, I will demonstrate a few for you now. For all of these exercises, it's important to set a timer on your phone. And another cool thing I think works well is if you do the exercises with your client, so they don't feel even more awkward or that you're just observing them. So it'll be a roll up your sleeves and get down to work. So the next exercise we're going to do is straw breathing, and I have 2 small coffee straws, and this would be for someone who feels like they're being smothered or they feel like their airway is being restricted. So they can have 1 straw, 1 big straw, or it's obviously harder the smaller the straws are. So basically, I'll just do this for about 10 seconds, but you want to put the straws in your mouth, and then it's even harder if you close off your nose so they're not tempted to cheat. It's harder than it looks, so here we go. So you could see over time that would get pretty hard, and you might start feeling that smothering feeling. This last one that I'll show you is a really challenging one for a lot of people because it produces a sense of unreality, shortness of breath, tingling, cold or hot feelings, dizziness or headache, etc. basically. So that's a bunch of stuff all in one, and the exercise is hyperventilating, which truly is not fun. I don't really struggle with panic at all, and this exercise makes me uncomfortable, especially if I were to do it the full minute. So I will demonstrate, really awkward, but only for like 10 seconds. So you want to breathe in as deeply as you can and as quickly as you can. So something like this. Okay, so the second half of, after you introduce the exercises that produce their anxiety sensations, the big important part is that they do these exercises for homework. So they can do them up to 5 times a day, and you want to encourage them to produce those symptoms or sensations as strong as possible and not to distract themselves, and then use all those good coping skills they have to lessen that anxiety after the minute of the exercise is done. And over time, they'll realize that the intensity of their fear of the physical symptoms will go down.